I guess when we think about the development of counselors, when we're in training, such as in your schooling, your practicum, your internship, we get a lot of support and supervision. You have the opportunity to have a clinical supervisor either on site or through your university that sits in your session as if they're, a third set of ears listening in, hearing and seeing kind of the fine-tuned pieces that we don't always hear when we're actively engaged and kind of immersed in the session. So what I see that this offers is continued supervision, not only in that initial part of somebody's development, but ongoing, to where you can go back and listen to your sessions, look at the transcription and see the themes and hear the words of the client in a different way. So when you're not kind of maybe overwhelmed by the content of the session, you see this kind of streamlined message coming through, where you see client cues, their repetitive language that sends messages that we might not hear in session. It becomes this lifelong tool for a counselor to enhance their skills, provide better outcomes for a client, to where you can really kind of bring in not only your own hunches as a counselor, but the client's language and words back to them to help understand these blind spots and help them develop better coping, better focus in their own sessions. It just, to me, it's invaluable in what it could offer for somebody throughout their development as a provider. And for me as a supervisor, it helps me rest easy, knowing that I have this ability to also kind of check in and look at how the person under my supervision is progressing and how their clients are receiving the care that is offered, and being able to improve the implementation of evidence-based practices, the treatment planning for the client, and how medical necessity is being justified. It just it ties it all together from the point of supervision, counselor development, client service, and outcomes and documentation. When I first heard about it, I thought initially this is just about documentation, compliance, which is what I do here at my agency. But it's so much more than that. I think it just, help reduce some burnout, give some really effective supervision, and help people develop as better practitioners, for sure.